So without further ado, I'm going to stop screen sharing and I'm going to hand over to Joe Langley for this afternoon's webinar.
Thank you very much, Andy. I'll just start the process of sharing my screen to put the slides on. I'm going to welcome Laura Evans and Fiona Marshall, who are going to be tag teaming this presentation with me. I've had a quick look through the guests. It's wonderful to see so many people, and I can't help but drop a dad joke here. I noticed we've got a guest called Gen Z, so no pressure. We've got an entire generation from the future coming back to listen to us here. So we better make this good. Can everyone see those slides? Super. Let's make a start. I'm going to have to go on to that. So today's topic, myself and Fiona and Laura are going to be talking about creativity and knowledge mobilisation. So as part of the No PH programme, co-production and creative methods are two core things that we pitched when we were bidding for the work, and they're kind of central to how we're trying to mobilise knowledge. And today's webinar is really focusing on creativity and trying to explain what we do, how we do it, and why we think it's important, why it makes a difference. So let's get started. One of the most common things we get people responding to is that I'm not a very creative person. We kind of like to dismiss that straight away. So everyone has some kind of element of creativity within them, and it's part of the processes that we go through about how we enable people to liberate that, and also see that it's sort of non-judgmental. It's not about different levels of creativity. Anything sort of level of creativity or ability is valuable within this space, and it's the use of imagination for original ideas to create something, inventiveness. It's that ability to sort of connect, make different connections that weren't perhaps made before. So it doesn't have to be necessarily coming up with a Picasso or anything sort of super as expected by the world, but just connecting different things that haven't previously been connected is the kind of things that we're defining as creative. We have between us tried many different things. This is just a snapshot. So talking heads, vignettes, personas, various different design methods, ideas and evidence jams, interactive exhibitions, Lego serious play, infographics, descriptive pictures, generative scribing, forum theatre, narrative games, etc. Loads of different stuff. It's really broad, and I guess the key thing with all of these things that we're trying is the way that it enables people to communicate differently, express their ideas, evidence, experiences differently, and enables others to see and think differently. It also has this capacity to externalize things which would otherwise be invisible and complex, and allow, in that externalization, it allows sort of mediation through things that are made into manifest and tangible stuff. So there's a few points that, as to what it's doing that we'd like to cover. The first is that it's engaging audiences. So people are far more engaged when you are able to put stuff in front of them. And we know this. I mean, we've moved a long way from the Victorian style of teaching in schools, where people just sat and read or were talked at or repeated things parrot fashion and relied just purely on words, to classroom exercises now, which are far more engaging, where people do stuff and play with stuff in the classroom. And the same applies to this. It's when you can put things in people's hands and images alongside words and descriptions, it makes things more visible and opens up and makes them more transparent. We've got a couple of examples illustrated here. One is taking a piece of evidence around what's called pajama paralysis. So that's the idea that if people are bedbound for 5 days or more, they might lose 10% of their muscle mass. And this is a problem in hospitals. So efforts to mobilize this evidence relied primarily on infographics and had limited effect. We took the idea of, what is 10%? Perhaps some people might, if they heard that, say, oh, this is great, I might lose some weight. So this can be interpreted in the wrong way. So what we did was we took that 10% and actually used images and models to and even with the, you can just see the slippers on the end there, to model the reduction in muscle mass and the instability. So it's moving from just a number through to something that people can touch and feel and even experience in terms of how it might limit their balance and proprioception. And with the map in the bottom, that was mapping people's decisions around where they would spend money based on need in Sheffield urgent care services. And so people's choices were made transparent, and the ethics behind those were made more visible as well. So taking things out from just words enables this ability to focus and reframe and reflect on what we're doing, but gives us the ability to have conversations and dialogues between people about what we're talking about. Laura.
Yeah, just to add to that, Joe, I think another example that's really useful there in the engage point is almost taking flat 2D visual activities that you might use. So thinking about you using post-it notes or your drawing methods, it's actually to make them 3D to have that engage effect. So an example of that we use an awful lot with research teams and also co-researchers from communities is something called the bridge of possibility. So that's co-creating a future together. So this is where you have a bridge and we physically build that bridge out of cardboard boxes, washing lines. We have sharks made of papier-mâché to understand where do we want to be in the future, so the far side of the bridge. Where are we now? And what resources do we have now to get to that future? And then what is our plan of action moving forward, with our sharks being our barriers and then our gusts of wind and struts being our enablers. So even doing something simple like turning a 2D activity that you might have in a toolkit or in a policy brief as a guide or a diagram, it's actually making that 3D. So these simple tweaks can actually help people experience your research process as well as your research findings in a much more visceral way that makes them more inclined to make the changes and change their behavior or actions that you're asking them to do. Thanks, Joe.
I couldn't agree more, Laura. I mean, this is something that we do a lot of in our work and practice as well. I think there's a great reference to drop here as well, a book called Unflattening by Nick Sousanis that talks about this process of going from words through to images, through to objects, and unflattening things in ideas into something that's more tangible and engaging. And I guess one of the things that we sort of get kind of push back against on this is that people can always have these conversations simply with words. So what does it add? And hopefully as we go through this presentation, that's some of one of the questions we'll begin to answer. So besides engaging audiences, another thing that the creative methods allow us to do is to communicate better. So words alone are not really adequate forms to express really, really complex stuff. People can misinterpret them, can interpret words in multiple different ways. And if we rely purely on words to communicate experiences and ideas, the ability or possibility that someone might take away something slightly different or completely different from our meaning. So we know what we're trying to communicate with the words that we use, but we don't know what someone else takes away from that. So as soon as we begin to, and we're not saying sort of substitute words for images or objects, it's words and images, words and objects together combined communicate far more powerfully and richly. There's also, I mean, evidence supporting this as well. So, I mean, Laura can talk far more about this, but the idea of that understanding might take about 6 seconds from text alone, whereas with visual data, we can, shrink that into 13 milliseconds in comparison in terms of the understanding, how quickly we can come to an understanding of what's being communicated. Oh, I've just lost my slides there. My screen's doing something. Sorry. Right. So engage, communicate, and understand. So that's kind of segueing from the last point that I made there. The sort of multi-sensory embodied learning sticks better. So giving people experiences means that they are learning more and learning better and more likely to recall and remember what's being communicated. It teaches theory and practice, whereas words alone just give people a theoretical understanding. I did a LinkedIn post about this recently. The know-how doesn't necessarily translate into know-doing. So you can have a manual that tells you how to change the wheel of a car, but I can't actually change the wheel of a car with that manual. I need other tools to do that. So the theory in the manual is just that, just theory. It doesn't give me the ability to act in the world without the tools as well. And we know, I mean, there's vast amounts of evidence from educational research around how play and fun are really key learning mechanisms, and allow that ability to shift people's perspectives, and also the sort of shared learning, and makes sort of making it a social exercise and activity amplifies what we're learning, and how much of it sticks. So we've tried a lot of this. We've done lots and lots of different things between us, as I said at the start. So what have we learned from doing this, and what can we pass on to you about how to do it? So I think one of the first points that we'd like to make is, whatever creative methods you use, whatever that might be, narrative is a really, really important kind of central theme within all of those methods. And there's a sort of number of different reasons for that. There's a theory of narrative thought, which is worth looking into and exploring further. I think there's evolutionary basis for why thinking in narratives is natural for us as humans, and also beneficial for us in terms of predicting the future. There's also this ability, other forms of communicating research evidence is reductive. It sort of reduces things to just a graph or a sort of set of numbers for a population, or an individual N=1 case study of one person's experience. But stories give us the ability to relate both of those two different scales together and keep the complexity. So you can have a sociological story, something really, really complex, keep that in there, but give it a way of making it human-centered and relatable, whilst also maintaining this sort of population and system-wide impacts and implications. The other thing which I think stories allows us to do really, really well is to combine so this is Aristotle's sort of 3 pillars of rhetoric, which Ollie Williams has been great at reminding me about a lot recently. So logical arguments, emotional arguments, and ethical arguments can all be combined and wrapped up within stories and narratives. I think one of the important things to consider with narratives, and when we're working with people using these creative methods, is that often it's that we can't address everything that comes up. And so it's really important to actually have a safety netting thing there and be really clear on what's in scope and what's out, but provide some sort of parking space for things that are out of scope. So we're not saying we're ignoring these things and don't acknowledge them, but we acknowledge them and put them to one side for now, with that idea of finding a way to come back and progress them through other pieces of work in the future. Another important thing that we've learnt a lot about is actually the importance of making whatever format it is that we use interactive. So as soon as people can interact with data and evidence, it becomes, again, that thing where they remember it more. It becomes something more for them and their interpretation. So again, I've got to refer this back to Ollie Williams. He used this mantra of show, don't tell. So academic outputs, journal publications, typically we say, we did this research, we found X, Y, Z. Our recommendations are blah, blah, blah. And it's telling people what the research has found and perhaps what they should do in response. But we know that that kind of top-down instructive telling people goes back to that Victorian style of teaching, doesn't work. It's not effective. Where if we can show people, or actually enable them to interact and come to their own conclusions about a piece of work, or even give them an experience, a simulation, so that they can have that embodied knowing. These are kind of various points along a scale of from telling someone, showing someone, interacting with evidence, through to giving them an experience that's related to the evidence. And this is where there's always a danger that people will have a slightly different conclusion from ours. So that's okay. This is, we can't be, you've got to have my interpretation of this thing. That's not how the most effective way of enabling people to really own this knowledge and evidence. So this is where we came up with that idea of being a curator, not a custodian. Laura?
Thanks, Joe. Yeah, I agree 100% with what you were saying there. I just wanted to come in actually on the narrative side of things. And there's actually a lot of research evidence out there that sees this approach of storytelling as crucial to changing NHS services. So actually, by allowing people to tell their stories, however that means, it means the best way to do it for them. So things like poetry, drawing their journey, it could be visual ethnography, photojournalism, video ethnography. They actually feel more embedded in the services that they're trying to recreate. I'll put some links in the chat or get Andy to send them out afterwards on some evidence there. And also, if I don't mind plugging something that I've written recently, I've written a book called Story Slingers, which is all about how to use storytelling in your research, not only as a communication tool, but also as a research process tool, as a research method to better engage and represent the voices of the people that you're working with. And then on the interactive side, it's a big thing that we're doing at Nifty Fox is how do we enable people to really engage with the research in their own terms, and as Joe said, make their own conclusions and come up with their own strategies for change rather than us spoon feeding them. So that is things like interactive infographics, which we'll show you in a bit, but also choose your own adventure animations, in-person and online exhibitions where you can curate your own experience and route through that research richness, especially for qualitative data, and actually then having products that you create of yourself out of those. So there's an example called More Than Medals. Again, I'll pop the link in the chat in a bit. But we took the experiences of female retired athletes. So these are ex-Olympians, to understand the gendered environments in sport that were playing into sports injury. So actually, there are many sports injuries that have no physiological origin between men and women, but can be attributed to the norms, cultures, and environments in the sport context. So we took all of this rich qualitative data and turned it into this interactive exhibition that was seen by coaches, the International Olympic Committee, the UK Sports Institute, and this touring exhibition that's now led to a huge culture change within those organisations where coaches are now being trained in this gendered environmental approach to ensure that we're giving all athletes, male and female, a level playing field when it comes to their environment. So that's an example where taking something into a creative storytelling realm has actually enabled people to interact with it and driven culture change because they have owned it and been part of that. Thanks, Joe.
That's a great example, Laura. And I'm glad you kind of raised that as well. So another, going back to this image here is another example where combines that idea of narrative and interaction. So this is a sort of evidence-based story case study from a particular NIHR study. But what we did was we fragmented the story into different pieces, each one on a card, and gave this to people so they had to reassemble the narrative. But in that process of reassembling the narrative, they were making sense of the data. And then a subsequent stage in this activity was one where, a bit like you were saying, Laura, actually, it's a kind of choose your own pathway. So they had to adopt a role and kind of model what they would do within this. So it's kind of combining narrative, interaction, and that sort of simulation side of things. So, yeah, we'll come back to this example here in the image. I think that's one we'll showcase later on because that's specifically part of the NoPH project. So collaborative, so narrative, interactive, and collaborative. This is collaborative with different stakeholders, relevant stakeholders, but also collaborative between creative people and researchers and healthcare professionals or service managers, etc. So collaborate, don't outsource. This is a big thing that we find, or we've sort of heard a lot from, and we've been approached to do this, is someone will do their research and then come to us at the end and say, oh, can you make a picture of this? Or can you, and it's, yeah, we can. They're often not great and usually not as effective as if you work with people throughout the research process. Go on, Fiona.
Yeah, just to go back a little bit.
Sorry.
So no, it's okay. What I wanted to mention really was the importance of storytelling enabled people from whatever background really to give context to their beliefs and their lived experiences as well. And I think that using creative methods also provides almost a safe method and approach of doing that, because it can be very, very daunting to sit in a formal meeting room or in a focus group or whatever and have to explain everything, whereas I found using these creative methods really opens up conversations because you're engaging with that emotional side of things, like you said earlier.
Yeah, that's really important, isn't it? I mean, that externalization thing. So one of the things, if someone's just sat in a room talking about their experiences and using just words, then once they're finished speaking, someone else can move on and the words can very quickly be forgotten or dismissed. But if you've made something to represent those experiences, it's sat on a table in front of you, it can't be ignored and kind of moved on and dismissed quite so easily, can it? So it gives it that representation. Long after you finish speaking, your experiences are still there, present in the room. And that's a very powerful kind of mechanism for ensuring that they're not lost within the dialogue that follows.
Absolutely. And I think just one little tip I'll just add is that we do have to think really carefully about the context, about where this work takes place, because some environments really are not suitable for some people. They can feel very uneasy, or particularly if they're in the workplace, they might still have that pressure and that little voice on the shoulder saying, I need to do this and that. So I think it's really to give people a lovely environment where they can really engage in these creative activities.
Go on, Laura.
And Fiona, I'm so glad you said that, because I think it's creating that environment in which we're challenging the traditional research hierarchy, which is usually you walk into a room, people do what you tell them, and then you walk out having extracted their knowledge. So actually, how can we use, through the very activities and creative methods we're using in that room, to completely rip apart that power structure? So things that we talk about are handing your participants the pen and go and show me, draw this with me, draw together. And that's something we referenced briefly earlier, which is this idea of generative scribing, which is where you're literally drawing your agenda together, the narratives that you want to see change together, and drawing the future together. And the whole premise of that is, how do we level the hierarchy by putting everybody in that room into a state of the beginner's mindset and the learner's mindset, and enabling people to express themselves through different forms of knowledge, which in that room are seen as safe. And another thing to think about when doing any creative methods is sort of the Maslow's hierarchy of needs, really, which is how can you make people feel comfortable, yes, but that they know where the loos are, they know where they're going, that people know their names, that what they're there for. And actually sometimes it's just creating those very simple signs for the people in the room that you care about them, care about their experience in the room, not only for the knowledge that they're going to co-create with you, but also as people, that you want them to have that space with you, not have that space almost in opposition to you. So Fiona, I'm so glad you talked about creating the environment for these things to work, because if people don't feel safe or heard or seen from the moment you first contact them, then how on earth are they going to do something that feels slightly outside of everybody's comfort zone? Thanks, Joe.
I think that's a really important part. It goes back to that question right on the first slide about people saying I'm not creative. So there's something about creative methods which is a huge leveler in that it can be, in a sense, equally uncomfortable for participants and researchers. Words are the kind of tools of academics and academia. So academics feel very comfortable in just sitting and having a conversation about things and relying purely on words. So as soon as we introduce creative methods like a Lego or something like that, then suddenly, some people will be more comfortable than others, but it's not based on their kind of knowledge basis. It's just on something that's a more universal kind of parameter. So I think that has a massive impact on creating those conditions. And I think there's something really important and interesting you said there as well, both of you, around safety and comfort. So I prioritize safety over comfort. I don't think these things necessarily have to be comfortable, they have to be safe, but innovation and talking about taboo things or stigmatizing things or inequalities can be uncomfortable. And that's actually what we're trying to do, is create the conditions where we can have those conversations, and where arguably the creative methods actually help to have those conversations, because they allow us to externalize some of these really challenging, difficult topics and have those conversations through the stuff, through the creative outputs, rather than sort of directly between people so much, but safety more important than comfort in this process, in my view. Okay, so other things to sort of pick up on in terms of the collaborative point, I think, is this idea of valuing creative expertise. So yes, everyone can be creative, and yes, everyone can do design and be designers, but there are people who specialize in these things and are exceptionally good at it. They have degrees in these things. They practice and have lots and lots of tips and tricks and things of the way that they do stuff, which makes them valuable contributors over and above just the idea of being creative. So I would always encourage that idea of collaborating with these people equally throughout a process, rather than tagging them on at the end and outsourcing this kind of activity. And when you do that, and when we've done that, and it's kind of we set those conditions up that Fiona talked about, that's when you begin to get that kind of blurring of those boundaries, where the creative contributors and creative partners become participants and researchers, and where researchers become creators. I think a really important point to make at this on this slide here is this idea of attribution and ownership. So many of the creative partners that we work with, they can be individual consultants, they can be small, medium, micro businesses. And it's really important, this idea of attributing the creative outputs that they have made to them, and acknowledging their input to this, even not just for the creative outputs, but also through the academic outputs and papers that are being written and so on. Ownership, I think, is something that needs to be negotiated on a case-by-case basis. As far as we're concerned with No PH, this is all about Creative Commons, making things accessible and open source, and that's part of our entire philosophy of what we're doing and why we're doing it and how. This may differ in some other cases, and so I think that's something that should be negotiated, but always the contribution of those creative partners should be taken into consideration, and at the very least, attribution should be made, because this is how they make their living. So what do you need to do this and to do it well? Funding, obviously, that's a given. I think the sort of size of budget varies considerably. I think it's always been a sort of slight frustration of mine. I often see huge portions of budget going into research teams to do these wonderful and elaborate, and there's this bit left at the end to do some of the design or co-design work. And the same with knowledge mobilization in general. That kind of gets that, oh, here's a kind of tagging on budget bit at the end that's kind of small portion. And that's, an internal frustration. I think that these bits of work or elements of the process are equally important and should be valued as equally. Laura?
Yeah, and just to pick up on this, like, actually lean on your creative partners to help you at bid stage. So we are one of the creative partners that Joe's talking about at Nifty Fox. We specialize in working with researchers to help translate their insights into impact, right from designing an application that is informed by the voice of the people that you're researching with, right through to co-design processes within the research itself, and at the end, when you're sharing and disseminating that work for impact. But actually, if you work with a partner from the very beginning at bid stage, it means that you'll have a much more accurate understanding of the work that goes into the things that you're costing for, so you can actually cost appropriately and you don't get halfway through and realize you've run out of money. But B, also as a creative team who have a research background, so I trained as a social researcher, there's also ideas there on how you can do things differently so that your application will actually stand out in the eyes of your funder, because you aren't just creating a toolkit at the end and you aren't just doing an infographic at the end. There is actually an innovation in the way that you are doing the research for knowledge mobilization from the very, very beginning. So yeah, just to basically back up what Joe said, and actually you think about partnership rather than order takers, and you will have a much more robust research application that's more likely to be funded. But not only that, you will have a much better output and impact route at the other end as a result.
I think that, yeah, I mean, everything that Laura's just said. I think this is the slide where we've probably got the kind of least specificity, because it really is horses for courses, and as long as a piece of string. I think the key thing, and I've put it in capital letters there, is about knowing your audience, if possible. So sometimes it's everyone that can be your audience, which is fine if that's appropriate and you've given really good thought and consideration to that. But the more you can specify and know your audience, the better. And we've got a couple of small anecdotes for this. I think there was one that was about outputs that were produced as a podcast, and the podcasts were 40 minutes long, but they found that their specific audience was a specific group of doctors weren't engaged with it. And then they on understanding that the doctors transfer between one hospital and another on a 20-minute journey, and they shrank the podcast to 20 minutes, they would have far more engagement with the outputs. And so that's what they did. And the number of people listening to these 20-minute podcasts, and that's just such a small piece of detail about knowing your audience that had quite a transformational effect. So sometimes if you know your audience, it might be a very specific group of healthcare professionals or teachers or whoever it is, you can do something which is more costly per person. It might be developing a training package that's a simulation and loads of other things, but because you know your audience, you can do it far more effectively to create change within that entire population. Whereas if it's, and so you might have a kind of more expensive output and you might invest more in it. Whereas if it's something that's more general, you might think about things that are lower cost and broader and have wider channels. But knowing as much detail as possible about the audience or audiences that you were trying to communicate with, both throughout the research process and at the end when you're disseminating or trying to mobilize that knowledge, gives you a much greater advantage in terms of specifying the resources that you'll need and making it fit for purpose. So evaluation, always important with everything, and this is probably where the researchers in the audience are far more comfortable and familiar. With all of these processes, it's really, really challenging because it's different every time you do it. So that ability to compare and contrast across different case studies becomes very, very complex, and knowing which creative methods are more effective for which audiences or which types of evidence or the types of topics that you're exploring, it's really hard to know that. And I mean, it's one of the things that we're trying to come to some understanding of, but and I guess the key thing is to collect as much data as possible about both the process you go through and what creative methods are used, and the things that are created that come out of that as well. And it might be that we can't answer these questions about which is most effective within this particular project, but gradually over multiple projects, if we all collect more of this data around process and product, we will have enough to kind of retrospectively evaluate and come to some kind of better understanding. So yeah, it's a big challenge. One of the other things to think about as well is in collecting this data is going back to that point around creating the right conditions. Sometimes there's a kind of trade-off in terms of creating those conditions to have something really creative where people are contributing openly and there's a safe space. So then kind of interrupting that and going, okay, so now we want to understand your experiences of doing that and collect data from you about your experience of being creative. And that can kind of disrupt that entire kind of effect and so on. So making the sort of data collection as swift and as unintrusive as possible when you're collecting data throughout a kind of creative or co-production process is really, really, really important. And there's kind of various methods, like the after action review is one where it's looking at what people expected, what they actually experienced, and what improvements they could suggest. I think there's kind of collecting data around the interactions between people, how included people feel, and whether they feel that the goals of their process were achieved. But different kinds of data, making it as multidimensional as possible, is really what we're trying to go for, but as unintrusively or ways which don't impact the process. Laura, did you want to speak about the 3 Ps model that you use?
I would love to. Thanks, Joe. So something that we do at our end, folks, as Joe's alluded to, we often put the evaluation onus at the end. So what's the impact of the thing, the output that we create? So we can do that through analytics and some sort of vanity metrics. But the other thing that we forget is actually the whole run up to the thing itself. So something we do at Nifty Fox is think about the profiles of the people involved. So have we engaged with underserved communities or people who've traditionally not engaged in this research before in that process? And if so, that is an evaluation and impact win. Number two, the process itself, which Joe has talked about briefly there, is what have we done differently that moves either our methodology forward or our theory forward or our relationships forward in that space. So that could be using co-design methods that haven't been used before, or connecting people from different organizations and communities who haven't been connected before. So it's all of the juicy stuff that happens as almost a byproduct of your research that didn't exist before that could continue afterwards. So that process of relationship building, skills development, as well as the methodology. And then finally, it is about the product at the end and what happens. But it's not just how many people see it, it's what people then go on to do with it, and also whether that's been disseminated in a different way. For example, you smashing it out on X or Blue Sky is one way, but how much more powerful is it if you then hand that off to a co-researcher who then goes back to their community organisation or their family or their local mental health group and starts sharing it there. And there's something about how your thing evolves that's very exciting. And something that we're working with the NoPH team on is how can we almost create templates and frameworks for people to take the stuff that we create and apply it to their own context. So there's something about that adaptation and change that's very, very important, but wouldn't necessarily be seen as impact with a big I to say this policy changed or this X amount of businesses used this. It's actually how has this then fundamentally shifted the paradigm in this area and is now being changed and adapted into different kind of impact vehicles, if you like. So that profiles, process and product are really important to us at Nifty, that we build in from the very beginning and help our clients to see that and take that data on board. I really resonate with what Joe said there about consistent data collection that feels inobtrusive and easy, because if it's inobtrusive and easy, you're more likely to do it. And also the people you're working with are more likely to give you that feedback. So that's something that's really important there. Thanks, Joe.
That was a really interesting thing you were saying there about the adaptation of what's produced at the end. I think that goes back to that point around being a curator rather than a custodian of something. So if you hold on too tightly to this idea of what's made and produced, it almost restricts it from being used out in the wild. When things go, I mean, when knowledge becomes personal, it'll always evolve. That's the point. So it's having the confidence to be able to, but then the systems for tracking that become really, really, really challenging. Which, you know, I'd rather have the challenge of trying to evaluate that rather than have evaluation processes that restrict that from happening, which I think can sometimes happen where it becomes, you know, the tail wagging the dog, where the emphasis on evaluating something restricts the ability for it to actually go out and be used almost. Oh, I've lost my slides again. There we go. Right. Okay, so we come on to an example. We're going to revisit the interactive one that we saw earlier. So the deep co-production arm that Andy referred to in the introduction, the first deep co-production project we've been working on is to do with housing planning, health impact assessments. And we're still in the middle of that. We've got a number of pieces of work going on with different local authorities. But one aspect of this has been around how, I mean, there's such a vast array of relevant evidence just from the NIHR portfolio, let alone others that relate to these topics of housing and planning, community development and health impact assessment. So people working in local authorities have such little time to be able to take on all of this vast array of evidence. That how can we make it easier for them? And this is where working with Fiona did an amazing sort of summary of various different evidence topics that were all relevant. And this is not all of them at all. This is just some of them that we've got here represented in this graphic. And then we worked with Laura and Nifty Fox team to find ways to really not condense, because that sounds reductive, and not summarize. That's again perhaps a wrong kind of word, but it's this idea of these are the kind of giving it a narrative, making it interactive, and the human-centered narrative bit is really important. So I'm going to go through these one by one. Let's start with, well, actually we're going to go straight to the actual board. Let's do that instead. See if it comes up. Can you see this now? Is this coming up?
Not for me yet, Joe.
Ah, do I have to switch the tab that I'm sharing?
I think so.
Yes, you will do, Joe. Also very conscious of time, so we've got time for questions. So I know a lot of people will probably need to head off around 1 o'clock if they've got other commitments, so just be aware of the time.
I'll whiz through this then. Can you see it now? Is that visible?
No, it's not, sadly.
So what are you seeing now on the shared screen?
The same slide, Joe, with the flashing red.
Okay, I'll stick with that then. So when you click on these various different tabs, you should pull up a sort of narrative component. Sorry, let's go on to this one here, the narrative that summarizes the evidence and makes it human-centered, and gives a kind of visual depiction of what the evidence is really summarizing. And alongside that, you'll then be able to click onto links as to the specific evidence base and the specific references we're called upon. And then the last one, which I think I've already clicked through, unfortunately, is one which will really link directly to the health outcomes or potential outcomes for different stakeholders. We should be able to pop the link to this into the chat. I don't know if Andy can pull it up and drop it into the chat.
Done it, folks. Done it. It's in there.
Super. Thank you very much. So people can click through and have a look at that. So I don't know if Laura and Fiona, if you want to come in and talk more about this as a kind of, this is one example that's kind of really quick to summarize.
Liz, if it's all right with you, do you mind if I jump in?
Yeah.
Yeah. No, I think Liz is unmuted to go, yeah, that's fine. So I love that we're doing the etiquette. I think the thing that's really interesting for us is that we were presented the evidence, and then our job was to create the almost composite case studies, so fictional stories that feel real, to make it feel like reality. So something that the local authority decision makers were struggling with was almost what's the human impact behind that? What's the real life effects? So for each one of these settlers of Catan-like hexagons, we thought about how can we turn this into a character-driven story that has a real human feel behind it, that actually highlights some of the everyday impacts of the policy gaps that we have right now. So, for example, we talked about in fuel poverty, the impact. I think this could have been Nisha and Sunny. So Nisha had COPD, and the fact that they couldn't make sure that their house was insulated correctly was exacerbating her health symptoms, which meant she couldn't see her grandkids. That then led to this kind of mental health challenge as well. So it was also showing through these real stories how these interlinking factors work together to influence someone's health, not just the initial thought about fuel poverty. We also talked about different structural inequalities, so things like accessing funding from the council, or even having the knowledge of where to go to ask for help, or know what to do with your hard-earned cash to insulate your house. So it's really interesting for us as a creative team to find out how we can translate this evidence into something that felt like a real human story. Liz, was there anything you wanted to add?
I think in the interest of time, we'll sorry, Liz.
No, that's fine. I was just going to say, I'll leave that for people to think about, and then move on to questions. We've got some good questions in the chat, Joe.
Let's go with the questions, because I know I'm going to stop sharing and go with the questions, because that's pretty much it. It was like, what's next for us? But questions are next for us.
Okay, so just time for some questions then. And again, everyone can be contacted afterwards. So if you've got any questions for Laura or Joe or Liz or Fiona about any specific things, you can find us, and I'll post the links in there as well. There was a question going back, I think, which Laura's going to pick up on with regards, I think it was regards to sort of funding within.
Yeah, I've got it, Andy. Thank you. So Kate was asking about involving the creators at the outset. Sounds like a great idea. How do you find creative teams to link up with, and how could that involvement at bid stage be funded if funding isn't yet in place? Kate, I'm going to give you a really glib answer, then a slightly more open one, which is Nifty Fox Creative, this is literally our job. So we work with only academics across the world. So we've worked with 50 institutions internationally. We've worked with over 3,000 researchers, been involved in several multi-million-pound research bids. The NIHR know who we are, the Wellcome Trust know who we are, ESRC know who we are. So reach out to us would be my glib answer. However, my less glib answer is each of your universities or organisations will have a creative supplier list. So you can actually go and ask your comms team or your procurement team of who is already an approved supplier. So that's one way of going about it. Another way that we've known some of our clients to do this is to ask your networks, who's good, who have you worked with, and how did they engage with the process. But I would say whoever you choose to work with, look for people who want to genuinely understand your research and are open to engaging with your team and research participants to help you build the thing. If they just want you to give them a script and then they go away and create an animation or an infographic, that's probably not the kind of partnership that you want. Something that we pride ourselves on is that we want to be involved as early as possible, be part of that writing process with you, and actually contribute to the knowledge that's created as a result. And that's where our research nerds show. The second part of how could that involvement at bid stage be funded if funding isn't in place yet? Something that we do is we give our time for free at bid stage, because it makes business sense. If we invest a couple of days up front to help you, then that could pay off dividends later on. So I'm not saying that everybody works like that, and we're in a fortunate position where we're a bigger team than other creative agencies and we've been doing this a long time, so we can offer that. But I think if any partner worth their salt, sometimes you have to put in a bit of extra effort up front to make that happen for the long-term rewards. So yeah, make sure that you're engaging with somebody that you feel like gets your research and wants to continue to give a monkeys about it and wants to engage with you throughout the whole process, and not just you, your participants as well. I hope that answers that question, Kate.
I think there's something to add to that, if I could, very quickly. So you have previous experience, Laura, as a social researcher.
Yeah.
I think that we shouldn't underestimate how complex and difficult actually working with academics is and working with the academic system. So if you just get a creative agency off the high street that's never worked with academics before, you need to factor in some kind of time for them to understand you as much as for you to understand them. Whereas if you've kind of worked with creative methods researchers or such as Laura's team or our team as well, because we are based in a university and we are researchers as well. So we're not like a high street design agency. So there's kind of blending of two very different kind of domains and environments there that needs to happen.
Thank you. So another question from Liz C. Liz is a LARP, local authority research practitioner, desperately trying to get people to use creative methods for understanding community voice. I'd love to know if anyone's had any success in a local authority setting and the hook you've used. I get a lot of interest, but unsure how it will play out just yet. And said, I'm biased, though, because I'm a creative methods researcher.
We've had, I mean, in the interest of time, I'm going to keep this really, really brief. We've had some success. I'd also point to the amazing work that Sarah Smith has done in Doncaster local authority. She also goes under the name of Smiz, SMIZZ. So look her up. She used to be a counsellor there. She's also an artist in her own right and a radiotherapist as well. So she's got lots of different hats that she can wear simultaneously. I think the main thing that we've it goes back to the point about knowing your audience. So it's getting the right methods for the community you want to engage with and working with them. So there's a kind of pre-contact sort of contacts and interactions to have conversations with them and explore what they want to do, how they want to set it up, what kind of making it a community event in which those creative methods can take place. But it's an iterative conversation. It's not about going in there with a preformed idea. Go in there, make contact, form a relationship, and understand what they want to achieve, as well as what methods they're kind of excited about and open to.
Thank you, Joe. Now, there's been some comments which I think hopefully Liz has picked up. There's people posting their contact details. And again, you can get in touch with us after this. There's a question here, interesting question from Paul. I was once involved in an event which used Lego as a tool for engagement in reforming public health in Scotland. It worked really well. People confidently thinking broadly and interacting without anybody dominating. However, the headline in the Scottish Sun was health chiefs blasted over £3,000 trip to Edinburgh Zoo to play with Lego. Do you have any advice for how to balance use of these innovative methods with potential preconceptions, apart from don't use meeting rooms at a zoo?
So Fiona's had some direct experience of this in this project. I think it was a piece of work she was doing as part of the Rapid Arm, where people in a local authority actually went and drew the curtains on the room in which they were using Lego to avoid exactly that kind of scenario and situation. So there's many kind of different facets to this. I think the easy thing to do would be to shy away from using creative methods, but I think it's about addressing this head on and taking the opportunity to educate people. So there is a really important theoretical basis to the use of creative methods. They allow people to see things differently, think differently. If you keep using words to explore issues and problems and challenges, you're going to come to the same conclusions and you're never going to solve them. You need to be able to see things differently, see the problems and challenges differently, to be able to then explore different ways of addressing and solving them. So having some of that understanding around the benefits and values of creative methods, I think, is really, really important. And that theoretical basis to it allows you to have those arguments and convince people. And then obviously that's a case of how things are framed and pitched and publicized as to how we can head off, in a sense, the negative media. So if you can anticipate that that might be a headline, then a kind of release of this is what we're going to do because, and it has all of that theoretical underpinning, then they don't have a story.
I'd back that up actually, Joe, and say, kind of summarize it into three things. One is, let's look at the problem that we're trying to solve and why everything else we've tried hasn't worked. Because if we're going to do more of the same, we're going to get more of the same crap, essentially. Two is then making sure you've got the theoretical and evidence base behind it, not just from a scientific point of view or a research point of view, but also a practical example point of view. And then three is the proof is in the pudding. Show people what the outputs are and communicate throughout. So why hasn't it worked before? And why are we doing it differently? Here's the evidence base behind it, case studies and the science. And then here's actually what the change has happened.
Thank you.
Yeah,
Sorry, go on, Fiona.
I think you do need to also perhaps preempt any Lego series play by actually sharing with the people you're working with the theoretical underpinnings of it and why you're not just doing Lego. She said, just before a session, and then I think people will be more receptive.
Thank you, Fiona. A quick question aimed at Joe from Ruth. The book you mentioned, did you say it was called Unflattening?
I did. I've just put, and I apologise, it is Amazon. I've just put the Amazon link to it in there, but that should give you, you'd be able to buy it elsewhere. It's not that expensive. I think it's like 18 quid or something. It's brilliant. I absolutely love it.
Thank you. Is there any other questions? I realise we're at time. There's various comments. There's a lot of contact sharing here. I think there's going to be a discussion going on after this, and certainly potential collaborations, hopefully. Does anyone have any final questions? If not, any final comments from any of our speakers before we wrap up? I want to thank people for giving their time today and joining us. Any final comments from anybody?
Just to say from my own team, I've in the background been live illustrating the discussion today. So I won't go through it now because I know that we're all super busy and I've got stuff to go on to, but I'll make sure that that Andy shares this with everyone. So some of the key points here are what we've discussed today, and that hopefully shows you rather than tells you some of the impact of creative methods in delivering research impact. But thank you all for having us.
Thank you. We'll leave this up for a while so people can just have a look at this. Thanks for doing this, Laura. You are the typification of multitasking here. That you've been reading the chat, you've been live scribing, you've been talking, answering questions. So fantastic effort. You've earned yourself some chocolate this afternoon. So yes, thank you, and we will share that. We'll share that on our social media, and we'll also put that, if we can put that on a part of our Fig Share collection. Laura, if you
remember attribution.
And attribution. So
already at the bottom, way ahead of you.
there we go. So absolutely brilliant. So thank you so much. This has been recorded. It will be shared with everybody, and thank you for your time today. It's been a really engaging session, so it's been good. Thank you.